I'm here to talk about my wife, Kelly, and what happened to her. June 13th, 2004, Kelly and our daughter, Joe, and I were up at campground in northwest Arkansas, about 50 miles out of Fort Smith, called Lonesome Deep, and it's for camping and riding horses. The two of them were riding their horses around the camping area, and basically Kelly started to fall off of her horse, and her left foot got stuck in the stirrup, which pitched her back on her head, and she landed on a huge rock. And I got to her pretty quickly. She was bleeding out of her nose and her mouth and both ears. So 911 was called. They got there pretty quick from the small town. They really were excellent. But they called in a med flight and took her to St. Edward's Mercy in Fort Smith. And by the time Joe and I got there driving the car, the neurosurgeon, Dr. Andrew Johnson, had already done the CTs and the MRIs and all that, and he told me that she had a traumatic brain injury. And it was a closed head, so she was still bleeding inside, and there was so much blood that he couldn't tell how much damage. So he said there was two choices. First one, to do surgery to see if they could save her life, see if, how much damage there was. Or if decided not to do the surgery, she probably had less than an hour to live. Of course, I told him to do the surgery. And when they took her in, my daughter and I went to the waiting room, and I called her family, and then I called United Healthcare, our insurance, reported the accident. After the surgery, he told me that there was extensive damage to her brain, bruising her brain stem. He had to take a quarter of her frontal lobe out on this side and a quarter of her left hemisphere out. They took the whole left side of her skull off and froze the skull bone, and it was 2 months later they were finally able to put the bone back in place. When she did come out of a coma a few weeks later, she was totally paralyzed, total amnesia, couldn't even blink her eyes. But with a lot of excellent people, she has fought her way back, amazingly. They said she'd never walk again. They said if she could tie her shoes and feed herself in 2 years, she'd be doing very good. Now she can drive a car, plays on the computer, but she had to retire because she couldn't work anymore. She has a lot of health problems from it. But the main problem is what United Healthcare did primarily. 3 weeks after her surgery, just about the time she was waking up from her coma, I got the first statements in the mail from United Healthcare. And they were denying responsibility for payments because I hadn't reported the accident. Well, since I worked for the phone company, I finally had a light bulb go off that I'd call them on my cell phone. So I had the date, the time, the number dialed, the minutes, everything. So they didn't like that much, but since that didn't work out for them, then they wanted to say that, well, she was out of network, that I should have brought her back to the Little Rock area. We live in Bryan. So we fought a lot, and they eventually started paying some of the bills, but in the process they would deny referrals to other doctors, from neuropsychologists to tests. Just got a letter in the mail yesterday from United Healthcare. She had had 4 tests done, and they didn't pay a penny on it. Now they're playing the game of, well, Medicare is supposed to pay. And so still going around and around with them over her. So the point is that through their actions, we ended up with several $100,000 in bills. We sold everything that we could sell, to the point that we wanted to save the home we bought in 84 in Bryan. And You still end up filing bankruptcy. And we'll be paying on that for a while yet, even though it's been 3.5 years so far. But that's what United Healthcare has done for us. And you would think through AT&T and the benefits and everything, it was been an excellent policy, but they don't care. So that's why I'm here.